Well, good evening, everyone. Kevin Henson with the Graham Star coming to you this evening from the Graham County Health Department. We've been asked to come and do a live Q&A, and I think it'll be very informative and helpful for everyone as far as this COVID-19 pandemic. We're a year and a half into it, and we've got some people here that want to discuss it, answer your questions. And for the people you see on screen, just get you guys to introduce yourselves first of all, starting with Beth over here to the left.
All right, I'm Beth Booth, and I'm the Graham County Health Director.
Lorita Eller, Nursing Supervisor.
Daniel Stewart, Pastor Cedar Cliff Baptist Church.
Good afternoon, everyone. I'm Jason Marino, Graham County Manager, and I just want to say I'm absolutely glad to be here for this very important Q&A that we're about to have. It's something important for our community, so I'm glad to be here.
And as I mentioned, 18 months into a pandemic, what's the state of Graham County right now? What's the current situation? I mean, that may be a very obvious answer, but where are we at, guys?
Graham County continues to be #1 in the state for the highest COVID positivity rate by our population. In the last 30 days, we've had 251 positive COVID cases. In the last 2 weeks, we've had 177 positive COVID cases. So we're definitely on the increase. We do not see an end in sight as long as we remain with a vaccination rate at 35%.
And 35% being for the county's residents, not
Yes.
for, because...
Yes. For the county residents.
Right.
Mhm.
Right. And all of this, of course, we were just a few months ago, everybody was like, ooh, we've got some weeks here where we've had no new cases, maybe one here or there, hit and miss. This is the Delta variant hitting us, correct?
It is.
Kind of explain the Delta variant to us.
You want to take that one?
Sure. So, well, as far as the variants go, there's several of them out there. Delta is not the only one. The biggest thing to remember with variants is the more hosts you give a virus, the more times it's going to mutate. So when Delta made its appearance, you now have a virus that used to have a 2-to-1 ratio. So one person infected would infect 2 more people. The Delta variant is 1-to-6. So one person can infect up to 6 people. So you're looking at a virus that is much more infectious than when it first hit. As far as it being more deadly, the mortality rate seems to be remaining stable, but the problem is so many people are infected that our death numbers are climbing and they're not stopping.
Do you think that's because of people traveling? There was a lot of isolation for a while, and then people kind of got stir crazy, and then we had some travel take place. A lot of people went to, the beach, the different places over the world during the summer. Is that what's kind of causing the spike here in Graham, or what do you think it is? Because, again, not a big county. So how do we suddenly have this big surge here in Graham County?
Part of what we do in the health department with communicable disease is case investigation. So we do contact the individuals that have tested positive, and we do talk with them to see if we can pinpoint travel in the last 14 days. Have they attended a large gathering like a church service, a birthday party? And with our increase in cases, there are many links to birthday parties, links to attendance to a large gathering, a lot of household contacts testing positive. So we are seeing some trends there. I think as the people got more mobile and got out and about, then we saw an increase. And then with school reconvening with mask optionals, the second week of school, we definitely saw an increase in our students.
Right, and I was going to get to that next, because this has been a week, right here in Graham has been a week of just heavy news left and right. We had unfortunately another COVID death was confirmed this week. The schools went into a 2-week shutdown. There's been an outbreak, which we'll get to that in a second, reported at the nursing home again. So how do people like children that are getting infected, 18 and under, we'll just go with that for right now, how are they going to be able to get back to normal? I mean, send them home for 2 weeks. Is that really going to be a great reset when they go back with mask mandates and around everybody again? Or how do you guys feel about that plan?
The 2 weeks, the biggest thing with the 2 weeks is it does allow a reset on the quarantine period.
Okay, good.
That was one of the big issues, was we had so many children in quarantine, but we also had that many teachers in quarantine.
Yeah,
So, you know, you may have a classroom quarantine, but that teacher goes with them. So they were gonna get short-staffed and run out of teachers. So that 2 weeks is specifically designed to reset the quarantine period.
good.
So that way, those that were going on quarantine when school closed will be good to go when school starts back.
I personally think the 2 weeks was a great idea. Now the mask mandate, when they go back for, well, let's say a 3-week period until they reconvene in October, maybe everything will get back to normal.
And one thing with the mask mandate
Mhm.
is when they go back fully masked, everyone masked, that is going to greatly decrease the number of students that will be quarantined.
Sure.
So if the student next to them is positive and they're wearing a mask, those children, we've placed several hundred in quarantine just in the last 2 weeks.
Wow.
And so that's going to basically see that decrease to very minimal numbers. That will keep the students active in sports, able to have as normal as we can have right now. Students 12 and above that are fully vaccinated, if they have an exposure and they're not having any symptoms, they do not have to quarantine. So they can have a normal, as much as we can have at this time. But I think one of the things that we as adults need to really focus on with our children, they're looking to us and our attitudes to make their new normal. So we need to try to be encouraging. We need to try to show them that, you know, even though things have changed drastically, that we can still have great lives. We can enjoy every day. And they need to see that in us. And I'm guilty. They need to see that more.
Just seeing all of us, I agree. Since this conversation is going to steer in this way, we'll just go ahead and jump down to the vaccine itself. There's still a lot of questions out there. There's people speculating every day online. There's a lot of bickering back and forth, which just makes me sad for the world, honestly. And then you've got people in the Grand Star debating back and forth. So there's a lot of misinformation. There's a lot of myths. What would you guys like to say, maybe to encourage or dispel? You know, what would you guys like to say about all that?
Well, I have 27 years experience in vaccines. That's what I was hired to do at the health department. This vaccine is no different than any of our other life-saving vaccines. Contrary to a lot of the misinformation out there, this vaccine was not just developed a few months ago, this method, this technology.
Mm-hmm.
The mRNA technology has been around for years, studied and evaluated. The vaccines are safe. I go by the information from the Advisory Committee on Immunization Practices. They are the ones that define the safety of the vaccine. They do the schedules, the recommendations, along with the CDC. But this is proven to be a safe vaccine. When you look at the numbers of vaccinations we've done in Graham County, close to 5,000, we have had no one die from the vaccine and no one hospitalized related to serious side effects from the vaccine. We have had 950 plus positive COVID cases in Graham County, and today, at this moment in time, we have 18 confirmed deaths.
Right.
You do the math, and it tells you the odds.
Sure. How does the vaccine itself actually protect you, though? Because there's a lot of people that are afraid to take it, but then you'll hear, and I'll just say, you'll hear people say, "Oh, well, you still get sick if you get the vaccine. You can still catch it," and you can. But how does it help you battle it if you do catch it?
There's no vaccine that's 100% effective.
Right.
The way this vaccine works, as many other vaccines work, is it gives you protection. If you do become infected with COVID, you are 99% chance that you will not be on a ventilator and that you will not die from COVID. So the vaccine has a very, very high rate of decreasing the risk for mortality from this disease.
What is the rate of reinfection? Let's say if you get sick, you get over it. Is that a common occurrence?
It can happen.
Okay.
And if you were infected with COVID early on, with the first initial strain, the Delta strain is much stronger, much deadlier. There is absolutely the potential that you could be infected with that. The thing that gets confusing, and it's not the only thing about this that gets confusing.
Oh, there's a lot, yeah.
We know that.
That's why we're here. That's why we're here today.
Yes, yes, we know that. But the thing that gets confusing is if you tested positive for COVID in June, you may test positive for COVID for 3 months or longer. It doesn't mean you're still contagious. It just means that the virus is still showing up in your system. So a new infection is defined as testing positive for COVID more than 90 days after you initially tested. That would be considered a new infection. We have saw just a handful of reinfections, and those have been more so recently with the new strain.
With the new strain, right? Yeah.
And they had some data coming out of the DHHS within the last few days, actually, that said you were 2.5 times more likely to become reinfected with COVID if you were unvaccinated. So 250% chance of having a reinfection if you were unvaccinated.
Wow, that's a telling statement. What are the death numbers for COVID versus the vaccination? Like if people are vaccinated, are we really, really low? Are we, like, where are we at on that as far as the county, the state? Because I know the statewide numbers, people look at like, oh gosh, let's not say Mecklenburg, but let's say Mecklenburg, 'cause that's the biggest county in the state. Those numbers can scare you quickly because it's a big county. But for Graham, let's compare it to Graham. What are the numbers like? I mean, as far as the vaccinations preventing death, let's just say it that way. I don't know if it was a roundabout way of getting there.
Right, I think the last time we saw those numbers, it was you were 4 times more likely, or 400% more likely to die from COVID if you had not been vaccinated. So we just started in our state system tracking who was vaccinated and who was not, and that's very difficult to track in a death, especially.
Right.
Because if they were vaccinated out of state or, you know, whatever the case may be, some of that information gets lost. And I know we have been asked on a couple of occasions, are any of our deaths vaccinated? And we cannot report that right now simply because I don't want to report it if we don't know it.
Sure.
So,
And we do have a system that the state has put into place now, that when we do our case investigation with positive individuals, we are documenting whether or not they were vaccinated. So,
Okay.
So in the future, we should have a better
Right.
idea on that.
Right. And we were talking beforehand about, tracing this stuff after somebody passes away and is it harmful? What is that like if someone passes away and you got a medical examiner working on them, coroner, whatever? How long does it live in the body after you pass away? What do we know about postmortem with death, with COVID?
they do recommend in the mortuary setting for the people that are working on the body, especially to wear PPE. There was no firm dates given, but they definitely do not recommend, especially going without PPE if you're doing any aerosol on the body, so any cutting or anything like that that's going to cause spray. They said definitely want to wear some PPE in that case. But as far as people that don't work in the mortuary or just, close family and visitation and things like that, it should not create an issue.
That's good. That's good. But again, like, we're trying to get the numbers compiled, so I actually asked Ms. Eller this the other night, and I'll ask it again for our people here on Facebook. The data that we have, that you guys report 3 days a week or so on Facebook, and I'll share the post on our Facebook page and everything. Those numbers, when we first got started, there was a delay, I guess I'll use that word, as far as how quick we were getting cases back and confirmed. We still got a big delay now. Are we caught up? I mean, when I say caught up, I mean, are we like weeks behind, days behind?
We do not have a delay with the facilities that test within Graham County.
Okay.
Urgent care, Tallulah Health Center, the health department, we all test. We have those results same day. So that's great. If they are tested elsewhere, sometimes there's a little bit of delay. There's always been an issue in the number that is reported with WLOS. I think with their information coming through, there was a little bit of delay. But I think what's being put out there now is fairly accurate.
But and what's on the state website's probably behind too. So
Right.
so what you guys are reporting is practically the
Right.
most up to date data we have. Yeah.
The health department itself, we had to stop doing our daily report just as the numbers increased and we got so busy. We just.
Golly,
cannot
could you imagine
that.
trying to do that now? The way you were thinking.
No, not at all.
Yeah, because that's
Not
a
at
lot
all.
to trace right now. I mean, you guys are
Yes.
down here working all hours of the day and night trying to stay on top of this thing. Is there anything people can do at home? Maybe, you know, I know we've kind of talked a little bit about ivermectin. I've had actually had several people ask me about ivermectin. You know, can I take it? Should I take it? And I would love to know because that's came up to me a lot. But I mean, in all honesty, besides ivermectin, what can people do if they are homebodies and don't want to catch COVID?
Sure. So one of the biggest things, especially if you're vaccinated, but regardless of your vaccination status, is maintaining a healthy immune system. That's number one. You know, some people like to take vitamins, that's fine. And there's nothing wrong with taking vitamins. The biggest thing is your diet is going to contribute to that more than that vitamin will. So eating healthy, staying well hydrated, drinking plenty of water, you know, washing your hands, wearing the mask, keeping your 6 feet apart. All of those things boost your immune response.
Sure.
And the vaccine boosts your immune response, which is the reason that people that are vaccinated have a much lower risk of hospitalization and death, is because it boosts your immune system. So really, as far as home remedies, it's sort of like anybody else that wants to live a longer life, you live a healthier life, you know, and that applies to COVID as well. As far as the ivermectin thing,
Where did that start? Because I mean, I know we were discussing it before, but I've heard that for months now that people think that's a preventative.
Even Daniel or Jason may have some thoughts on this because I don't know where originally this came from.
Daniel, when did you first hear about ivermectin being maybe not a preventative, but maybe just like a way to fight it off or something?
Oh.
How long?
From the beginning.
Really? Okay. I wonder where that came from. So yeah. Anyway, I'm sorry.
Yeah. So
Continue.
what you're looking at with ivermectin, and the reason I said Daniel is because probably he has more experience with ivermectin than even I do. But
That goes with it. Yes.
ivermectin is a horse wormer. So what you're looking at with a wormer is it kills parasites. So it kills worms. And I think you will use ivermectin on dogs too, right? Yeah. So, but it seems to be the horse wormer for some reason. And the horse wormer is dosed to 500-pound increments because it's a very large animal.
Right.
And it says on the box, not for human consumption. So I kind of have nothing. I'm not really sure
Sure.
where that came from, or like I said, I don't know, since it's an anti-parasite. And that's, you know, because kind of being out in the community, I didn't know if you kind of had any better idea where it may have come from.
Yeah, I don't know. I've heard it a lot lately, so that's it. But as far as there is really nothing over the counter that you can take or even be prescribed.
I mean, supplements, you know, vitamins, zinc, vitamin C, what you normally would do during flu season.
To boost your immune system.
To
Yeah.
boost your immune system.
Right.
And I would like to talk a little bit, if we have a minute, about if you're tested positive. and you're at home, how to manage that?
Yes, absolutely, please.
So if you've tested positive and you're at home, you need to really pay attention to your symptoms. Now more so than ever with the situations with the hospitals being maxed out and long emergency room waits, maybe no ICU beds. If you notice that you're at home and your fever spikes, if it's 102, 103, 104, if you're coughing up blood, if you've noticed that you've got chest tightness, if you're short of breath, if you try to take a deep breath and you feel that you can't get that breath to move throughout your lungs, that is a 911 call. We do not want you staying home too late to get the medical care that you need to get. Some of the things you can do at home, you can walk. The worst thing you can do for congestion in your lungs is to lay down and lay flat on your back. When people are hospitalized, some of the treatment is they are put in a prone position, they are turned over on their stomachs. You need to move, you need to cough up what you can get coughed up, you need to really pay attention to what's going on with your body. And don't wait until you're so sick before you go to the hospital. Err on the side of caution. Stay well hydrated with water. Keep a check on your temperature at least twice a day. Just really pay attention to what's going on.
Yeah, one thing we have noticed with our COVID patients is when they turn quickly. So they could be home and they could be doing well, and then all of a sudden they are not doing well. So it doesn't seem to even be a gradual decline with some folks. They just tank. So.
And really pay attention to things that we take for granted, your urinary output. If you notice your urine turns dark, or you notice that you've not urinated in several hours, that could be dehydration. It could be that COVID has started to attack your kidneys, which it does. So those are things to really pay attention about.
Are we still seeing, there was some talk a few weeks ago of EMS crews in Graham, Swain, Cherokee, etc., having to sit in a parking lot in the ER for 5-6 hours waiting to drop a patient off because there was no room. Are we still seeing that today, or has that gotten
I
better?
haven't heard directly from EMS, but I have heard from the hospitals. And what I'm hearing from area hospitals, the hospitals across the Tennessee line also, they're maxed out.
Yeah. How? Somebody has asked this on here, and I think it's a pretty good question. If you have caught COVID, how long after until you can get the vaccine to maybe prevent it again?
If you have not received the plasma infusions, as soon as you are out of isolation and feeling well, we can vaccinate you.
So, and I know I'm breaking some of these down to very simple questions. I just want everybody to be well informed on here. If someone wants to come down here and get vaccinated, what can they expect? Kind of walk me through that process.
What we do is we like to schedule your appointment because the vials, the vaccine doses are in a multi-dose vial. So once we pop the top on that vial, we have a certain amount of time that we need to administer those vaccines, or we have to waste them. So we like to have a full schedule so that we're not wasting any doses. So call us, we'll get you scheduled. There's paperwork that you can pull up online, or you can do it when you come here. You will meet with a nurse that will go over a screening questionnaire, and usually that nurse ends up being me. But we'll screen and talk about your health history, any allergies you have. The purpose of the screening form is to make sure that there's no contraindications to us administering the vaccine. Then after you get past the screening process, you will have your vaccine administered, and then we will monitor you for a specific amount of time to make sure that you're doing well. There's information sheets that everyone gets to read over prior to receiving the vaccine. And we want to make sure that you're well educated and any questions you have are answered prior to receiving the vaccine.
And then for round 2,
It's pretty much the same process.
you go through the question.
Just a little bit.
Yeah.
But I mean, how long do you wait? I guess is where I'm going with that.
The round 2 for Moderna is 28 days.
Okay.
And we really take the calculation away from you. We give you an appointment when you come in. You flip
Good deal.
your card over, and on the back of the card is the next date for
Okay.
Moderna. Johnson & Johnson's a 1 dose. So there you go.
So that's why if people are looking on there and they see second dose
Yeah.
numbers and they're really low, that's
Yeah.
because some people might have got Johnson & Johnson.
Well, when you look at the numbers at the state level for fully vaccinated,
Mhm.
that takes into account Johnson &
Okay.
Johnson, 1 dose.
Yeah, it'll say, the state website says 1 dose and then fully vaccinated.
Mhm.
So the Johnson & Johnson is considered fully vaccinated 2 weeks after their first dose, or
And-
their only dose.
And here in the county, of course, we only have the Moderna and Johnson & Johnson because you guys want to explain the Pfizer, kind of why we don't have it
Sure.
on hand, I guess.
And it's not that we can't have Pfizer.
Sure, yeah, right.
The biggest thing with the Pfizer is it does require what's called ultra cold storage. So it has to be stored colder than even our freezers are capable of. Now, it can be stored in a refrigerator. The refrigerator time is only 30 days. So while we wouldn't mind keeping Pfizer, it would be sort of like Lorita said with the schedule.
Right.
Like we would have to schedule a certain number of people interested in the Pfizer before we pulled Pfizer. We have access to Pfizer, but I'm not going to request that until I know we can use it, because it does put a very tight timeline when we request it.
Has there been a lot of requests for Pfizer?
There actually has been a slight increase in the number requesting Pfizer when it dropped to 12. We do have a very good working relationship with Vaccinated, which is the mobile clinic that we've advertised on our Facebook page.
Right.
And they have done the door-to-door vaccines, and they've been at the school. So they've been very good. They only bring, I think, the Pfizer with them. I think they may have brought some J&J, but I think it's mostly Pfizer, because that's what people are requesting.
Sure.
So as long as the Vacino's crew is open to coming out here and vaccinating, and since they are willing to go door to door, it seems to have worked out very well. Especially since our younger kids are one of the bigger groups requesting it, they can't drive. So
Yeah.
they have actually gone to some of the houses of our kids and vaccinated them. So that's been very handy for them. But yeah, I mean, we wouldn't have any problem stocking Pfizer if we had enough people, because like Lorita said, it's a multi-dose vial. So if I go requesting Pfizer, we would have to have the supply.
Right,
The
supply and
demand
demand,
to meet the
right,
supply.
yeah, absolutely.
Yes.
I got you on that. Kind of explain the differences, Ms. Eller, on the vaccines that we do have on hand. Like pros and cons of Moderna and Johnson & Johnson.
They're very similar except for the dose schedule. Moderna is the mRNA vaccine, and like I said, it's not a new method for doing vaccinations. It's just a new vaccine. The mRNA method has been, or procedure has been studied for many, many years. It is the 2-dose series, 28 days apart. It does not alter your DNA. The mRNA vaccines, what the COVID vaccine does is there's no actual live virus COVID in the vaccine, but it does elicit a production of a spiky protein that mimics the COVID virus. It does not do anything except stimulate your immune system to develop antibodies. And then those antibodies are in your system so that when if you are exposed to the COVID virus, it's your army that comes out and fights.
Right.
Just like the pertussis vaccine, the tetanus vaccine, just like those vaccines. It's just a different method. It does not go and alter your DNA. Your DNA is located in the nucleus, the center of your cell. This does not penetrate that. So this is not going to alter your DNA at all. As with all vaccines, it will only work as well as our immune system allows it to work. So the more comorbidities or health issues that you have, the less healthy our immune system is. So I'll use myself as an example. I'm over the age of 55, I'm overweight, I have asthma, I have high blood pressure, and I have stage 3 kidney disease. So I know my immune system is not going to work as well as a healthy 21-year-old. So my vaccine is just one of the tools in my toolkit to help keep me healthy from COVID. The other is the mask and avoiding large crowds, hand washing, social distancing, those type things. So that is how the Moderna works. The Johnson & Johnson is, it attaches itself to an inactivated cold virus, the adenovirus, and that is how it stimulates your body to produce antibodies. It does not alter your immune or your DNA whatsoever. It won't give you a cold. It's an inactivated cold virus. So that's how those two work. Different procedures, different development, but the same outcome.
Absolutely.
Wow.
Wow. Oh, Daniel, Jason, I'm gonna let you guys ask some stuff if you got anything on your mind, because I'm pretty well caught up on what I had on my brain. So you guys.
I don't know what more could be said than what these ladies have done
Yeah.
medically, scientifically, part of the faith base. Got dear friends on, and I'm sorry to say, on both sides of this. It's
Sure.
very divisive, even divisive at our church. And this is just me. This is my thinking, my feeling. Being in Graham County, you know a lot of people, but what I'm seeing is, I'm seeing death from COVID. We have a funeral Friday, or Sunday rather, from COVID. I see suffering, I see heartbreak, and we can look at the numbers all over. The fact remains, these are human beings, and these ladies have poured their heart out to us. And as my conscience, I don't have the luxury for myself. Now, this is just for Daniel Stewart. I don't have the luxury to say it's my choice, because I'm part of this community, and I want what's best for everybody. I'm not trying to override anyone's choice in any way. But for me personally, I don't have that choice. Because if I was to infect my children, my grandchildren, my neighbor, or whatever, I would feel very, very responsible.
Sure.
And I don't know a whole lot about all of it. I talked to her before this thing, when it first started, and she's been such a help to me, and she knows what she's talking about. And the fact remains that I've got deacons in our church right now that's sick with COVID. I've had a deacon that had the vaccine, and yet he took it. He had all kinds of health issues, but it wasn't real bad on him at all. And he believes that had he not had the vaccine, it would have been a completely different story.
Sure.
So there's a lot of rhetoric, there's a lot of conspiracy theories, but the fact remains is simply this, has been just no common Joe in Graham County. The fact remains, this stuff is real.
Yes.
There's a lot of untruths been told, but it's real. We are not burying ideas. We're not visiting. Well, we can't visit our sick. Yesterday, just on my cell phone alone, not counting my home phone, I had 34 calls and texts. Sick people. It's bad.
It's heartbreaking.
It's very
That's really sad to
heartbreaking.
think about.
This is what I would recommend. This is my personal belief. This stuff is real. It's worldwide. I take my blood pressure medicine. I have AFib. I take my Eliquis. If I get sick, if I fall here to the floor, I want y'all to pray for me. But for goodness sakes, while somebody's praying, Jason, you call 911. I feel like that all good gifts comes from the Father of lights. That's what the book says. And I believe that that this vaccine is just like my Eliquis. It can help me. And they say that the argument is, and I'll be real brief, your bounds are set and cannot punish. But I promise you, I live on West Buffalo. I promise you that if you get in the middle of the road this time of year and try to drive from West Buffalo to town, I promise you that you'll have a motorcycle in your teeth.
Yeah.
I'm still going to drive on the right side of the road.
Yeah.
I'm going to take my medicine. I'm going to trust the Lord.
Yeah.
The Bible says, and that this faith over fear, I believe that. The Bible says He's not given us a spirit of fear.
Amen.
But
That's right.
it goes on, and of love and a sound mind. I want to love my neighbor. I hate wearing a mask. I didn't know about COVID. I don't know nothing about it yet besides what Lorita and these ladies have told me, and I appreciate that so much. But this is all I do know, and this is all I've got. There's a vaccine. I've taken it. I encourage my children to take it. A lot of our church family have not taken it. Does that make me better now? Absolutely not.
Right.
Just like everything else, there's a lot of confusion, a lot of it's been politicized. But we've got to get past that.
That's one of the saddest parts of this whole thing is how much it's been
So,
politicized.
pray about it and do the right thing, and everybody's to their own. I don't think that they're trying to take my choice away from me. It's my choice to take the vaccine,
Right.
to help my neighbor, and to help me. I don't want to get it.
Sure.
Amen.
Hey, all of God's people say.
Jason?
Yeah, I think a lot along with what Daniel said, I'd like to maybe offer more of a testimonial and to also reach out to our citizens in the county and our employees here with the county. The problem, and it starts with the misinformation that we see. You have the news, different channel, turn it to a channel, you might hear something. And even the ones that are high up in government may be changing or saying, understand this is new. And it's hard to understand for them even as they were learning to go around, as they were going along. Facebook, and I'm not saying that Facebook or Google or the internet can't provide good information, the right information, but there's misinformation. So as a testimonial, I would say, I was skeptical in the beginning too. It was important for me to wonder, okay, what am I hearing? What am I seeing? And is that the truth? And I knew there was a timeline. I didn't want to get in line in the beginning to take it because I wasn't going to get in front of anybody. So it was May before I got my first shot, and then June I got my final shot. And so I took that time to do that little bit of research, and I didn't depend on Facebook or the internet. I went to the source, Miss Lorita, Miss Beth, the doctors, my sister who was in the medical field, and she told me some things that just really blew my mind, made me understand it because I'm not a medical person. I even talked to military doctors, and I talked to doctor friends that are doing it now. I talked to 2 emergency physicians that worked in New York City during the actual height of the COVID mess that was going on there. They were recruited to go up. And my physician, who's at my primary care physician, who's at the Charles George VA Center in Asheville, and not one of them has told me not to take the shot. Every one of them was in consensus that it's safe. And not only that, wear a mask inside if you can, because it also protects others. So I would encourage you, if you were in my shoes, if you were that person that questioned that, if you're that person that you're on the fence, or even if you're completely dead set against it, reach out to those professionals that know and talk to them and have them maybe make you understand a little bit more about the shot. I would encourage everyone out there, if you haven't taken that vaccine, I'm not a medical person, but do the research, talk to them, and consider doing it. And if it sounds like maybe we're sounding the alarm, well, we are.
Yes.
Because we love all our citizens in this Graham County. The most important thing we have are our citizens that can keep this county thriving. And it's important for us to let you know of the things that can help to control this thing, to get back to normal. And I think that's where we need everyone to try to consider to get. And we just know that there's a problem out there, and this is the way to try to help. So I'm hoping people will take it for sure and listen and be serious about it. And I think all the hard work that our team here at the health department have done,
Absolutely.
and in this community, they've done amazing work. They've put a lot of hours in, and they deserve to be thanked you for this. So
Yeah.
thank you for doing this today.
They're doing an outstanding job, I think.
They absolutely are. Please reach out to anybody out there in our county or anywhere. If you want to reach out and ask those questions, if we can provide help, please, by all means, we will do that. And thank you, Kevin, for coming out and helping us on this.
Very glad to do it. Very glad.
If there's more questions at a further date or future date, if we want to do this again, we would certainly consider it, whatever it takes to get the information out, if there's more Q&A they want to handle. So.
Let me put a plug in for these ladies. Yes, this is their job, but this is their heart.
Yeah.
I know Lorita, she's doing it from her soul, and she means what she's telling you, and we're not looking down on anyone that don't get the shot, but we're encouraging you. We're asking Graham County, seemingly the medical's done all they can do for us, and I have nurses and stuff in my family, and they're exhausted. But they're asking the public for help. And so I trust these ladies with their numbers, and we're just glad to be here. But we love this county.
Yeah.
Not mad at anyone, we just need help. Bottom line, we need help.
The numbers have been frightening lately.
Yeah, and I think another piece that people need to understand, and we get this a lot, Lorita gets this a lot, and we get this a lot on Facebook, is how many people have recovered. And Lorita can definitely chime in more to this, but depending on the severity of the case, there is never a recovery, a full recovery. One of the big things to understand about COVID is it's only a component of it is respiratory. This is a whole system virus. People wind up on dialysis because of COVID. They wind up on oxygen because of COVID. They wind up with a shorter lifespan because of COVID. You know, I mean, there has been many people that we have said there are things worse than death. And it's because of COVID. So to dream it as it's a cold, it's like the flu, it's nothing like a cold, and it's nothing like the flu. You know, I mean, it's a whole system virus. It can damage, I mean, there is a reason that it says one of the symptoms is diarrhea. You know, that's not respiratory. You know, like she said, darker urine. Could that be dehydration? Yes, but could it be attacking your kidneys? Absolutely. You know, and a hospitalized case of COVID is going to probably shorten your lifespan. So I don't think recovery is a good number to report, because I don't think that there are people that will ever recover fully from COVID.
Long-term damage.
Very severe long-term damage.
We will have people that had severe cases of COVID in 2020 that we may lose in 2022, 2023. I mean, 2024, 5 years down the road, 10 years down the road because of the damage. And I have nothing to gain by telling you to get vaccinated. As I told Coy, as I told Daniel, when all this started, I never dreamed we would be sitting here today.
Year and a half later,
And
we're still
facing-
dealing with it.
Yes,
Yeah.
facing what we're facing. And when the vaccine was in development and we started getting information about the vaccine, I sat down with my husband and I said, before I will recommend or even educate about a vaccine, I'm gonna know that it's safe. I would never tell my county, my community, my neighbors, my friends to take a vaccine that I thought for 1 minute would hurt them. But I will scream from the rooftops to keep you from getting this terrible disease.
Yes.
I'm not here talking to you now as Lorita, the nursing supervisor. I'm here talking to you as your neighbor, as your friend. Please don't ever get used to the death press releases. Tell me that we've not got there. Please tell me that you're not getting used to those. Tell me it breaks your heart as bad as it does mine. I don't know what to do other than to put my heart out here and tell you it's broken.
Yes.
And I'm easy to get a hold of. Half the county has my cell number. So, 479-7900, extension 2617. Let's talk. Let's talk. I don't want you to do anything that brings you fear.
Yeah.
But more importantly, I don't want to lose you.
Yeah.
Amen.
You
Graham
think,
County, help us help Graham County, you citizens out there. The medical data supports it, the data's out there, the professionals support it. Just reach out and get those answers, and let's get this county vaccinated. Help us.
Let me say one thing real quickly. We're not here to benefit ourselves in any way. We're not getting paid to do this. I'm certainly not going to gain any popularity by doing this. I promise you. A lot of my dear church family, they will probably be upset at me, maybe, but again, I want to say again, with my conscience, what I believe, I do not have the luxury. I'm willing to forfeit whatever if I can keep from going to these funerals. It's not numbers, it's real people. It's real families that's suffering and begging for prayer and for help. And hey, I went to Honduras, I had to take shots. I'm in Graham County, so let's look at it as a mission field, get you shot. God bless.
I think that's no better way to end it. Thank you guys for this, and we'll come back if we need to in the future. Hopefully, we'll get some numbers up on the right side of things.
Thank you.
Vaccines. Thank you guys.